Thank you for providing me with these opportunities to share with you. I'm from the West China Second Hospital of Sichuan University. I think you have been familiar with our hospital. In fact, the HIFU treatment in our hospital starts late in 2000, October. In the past 2 years, we have more than 1,000 patients in the cases. In treating the uterine fibroid and adenomyosis, we have certain experiences. Today, my topic is the experience and the case sharing of HIFU in the treatment of uterine arteriovenous fistula. Uterine arteriovenous fistula is a rare disease in obstetrics and gynecology, which refers to the abnormal communication between the uterine artery and the vein. The arterial blood flows directly into the vein without passing through the capillaries. It was first identified and reported in 1926. It can be classified into congenital and acquired. For congenital, it is mostly caused by abnormal development of primitive vascular structure in the embryonic period, and it is more prevalent for the acquired disease. After the surgery, dilation and curettage, or surgery section, myomectomy, and it may also be related to infections, trophoblastic diseases, or the malignancies involving uterus, causing uterine damage or invading the uterine blood vessel wall, forming arteriovenous communication branches. As for clinical manifestation, it manifests in irregular vaginal bleeding. 50% of the bleeding occurs without walling, like a switch. The bleeding occurs and stops suddenly, and curettage may aggravate the vaginal bleeding. So we will not conduct DC on these patients identified as UAVF. As for the examinations, the first is the ultrasound. It manifests in the uneven echo in the myometrium. Disorderly twisted vascular plexus can be seen in the myometrium and endometrium. The blood vessels distribute focally or scatterly. The blood flow signal is rich, bright, and flowing in all directions, and it's colorful. And under MRI, the typical characteristic is vascular flow void effect. It can present localized or diffuse image structure in the lesion area. There is a clear enhancement of the lesion after contrast. This case can show you the vascular flow void effect. DSA is the gold standard for the diagnosis of UAFV. The typical image is thickened and tortuous bilateral uterine arteries. And in the early stage, thickening veins can be found flow in all directions, and the contrast agent could be shown at lesion site after the venous phase. And the contrast agent can also spill out of the blood vessels. And pathological examination is a standard examination. Uterine arteriovenous malformation can be found in hysterectomy specimen. However, we should notice that negative pathological examination cannot exclude the presence of UVFV. Accessory examination include the hysteroscopic and laparoscopic examinations. Palpating a vascular mass in the uterine cavity can be seen under hysteroscopy and could be enhanced by Valsalva maneuver. And uterine vascular malformation can also be found under laparoscopy. Differential diagnosis differentiates the uterine artery feudal aneurysma. This is a periarterial hematoma surrounding the arterial cavity. The periarterial hematoma is formed by the outflow of the blood due to defects in the uterine artery. This is a layer of loose connective tissue. This is related to our pregnancy or delivery. This is a CSP after DC. And the uterine aneurysm, it is a hematoma formed by local persistent dilation of the uterine artery due to congenital factors to trauma. Doppler finds that the blood flow in the mass is consistent with the uterine artery. This is under MRI. We can see the clear expansion of the vessel. This is also a patient after pregnancy. In the follow-up, it indicates the UAVF. It is a tumor instead of the UAVF. As for the treatment, there is no mature treatment for this disease and no consensus by the experts. It is still be determined according to the patient's etiology, symptoms, fertility requirements. Expectant management is suitable for patients who have no obvious clinical symptoms. And this kind of patients should have good follow-up. The second is drug treatment. It is suitable for patients who have little vaginal bleeding and stable hemodynamic, including estrogen, progesterone, oral contraceptives, GRHN. And third, hysteroscopic and laparoscopic treatment. It is suitable for patients who have stable vital signs, especially the patients secondary to pregnancy and UAVF may be caused by uterine cavity residue. And also the UAE, this is suitable for the patients who have unstable hemodynamic. Hysterectomy is the patients who have no desire for fertility and are in critical conditions or suffering from severe vaginal bleeding and other treatments, including the HIFU or percutaneous thinol. And next, I'd like to share with you one case in UAVF by HIFU. A 30 years old patient, 3 months after curettage, a lesion was found in the uterine cavity for 1 month. The patient underwent uterine curettage 3 months ago due to miscarriage 1 month ago, and we found a 3.1 centimeters hypoecho lesion in the right uterine hole. The lesion was full of blood flow signals, and the blood flow spectrum of fistula was detected. And HCG was 48. We have provided some medications for her with poor efficacy. And 2 days before she was enrolled to hospital, the vaginal bleeding increased and approached to volume of menstruation. After the ultrasound, and there is a 4.2 centimeters hypoecho was found in the right uterine hole. And the lesion was filled with blood flow signals. The blood flow spectrum was detected, and the thinning malmetrum in the right uterine was found. You can see that on the uterine hole there is a mixed signal, and on T2W1 there was mixed signal of high and low. And on the enhanced scan, there were patch enhancement, and the vascular flow avoid effect was found in multiple vessels with the myomectomy. This is MRI features, and the thinnest parts was about 0.7 centimeters, the myomectomy. For this patient, we have conducted a HIFU treatment with sonication time about 800 seconds. The power 0.32 million, and the post-operative MRI showed the vascular shadow within myomectomy was reduced, and the lesion in the right uterine hole was less obvious. And we have conducted a close follow-up on these patients. And 1 month after the surgery, her menstruation has resumed. 3 months after HIFU treatment, MRI showed that a low lesion was found in the uterine cavity. there is a clear absorption. The uterus cavity has recovered. A lot of patients have the symptom of UAVF, but not all the patients are suitable for HIFU treatment. So what are the characteristics of UAVF suitable for HIFU treatment? In terms of MRI, there should be a very clear vascular flow void effect and high T2 signal and obvious enhancement lesions on enhanced scan in the uterus. There should be residues, not only in the abnormality of the vessels. And the feature also includes the boundary between the lesion and the uterine wall tissue is not clear. For the intramural lesion, HIFU has more advantages. And compared with the lesion in the uterine cavities, HIFU boasts no advantages compared to traditional therapy. But with the disease that is intramural, HIFU boasts more advantages. There are more cases sharing. We can see this picture. There are clear vessels, blood flow, T2 signals. All these patients enjoys their efficacy of the HIFU treatment. So the occurrence of UAVF is mostly related to uterine cavity operation. Manifestation includes irregular vaginal bleeding, and bleeding occurs. There are various treatment methods. Individualized treatment methods are determined according to age, fertility requirements. HIFU can result in occlusion of blood vessels by ablating and absorbing residue lesion in uterus and uterine wall. It has a good clinical application prospect. Thank you.